Yeah, hi everyone. Now I'll be discussing about murmurs, which are important for examination point of view for the dental students. So before going into that individual things, okay, we have something called as grading related to this. Okay, so it starts from grade 1 to ends at grade 6. So grade 1 is it is audible under normal conditions, whereas grade 2 is okay, it is soft. Coming to the grade 3, the grade 3 is having you will have a moderate intensity, and the grade 4 is it is loud with a thrill. Okay, so next one is grade 5, it is very loud. Okay, and the last one is grade 6, it is heard with stethoscope and without touching the heart. Okay, so it is heard with stethoscope but without touching the chest. Okay, so these are about the grades, and grade 4 is once asked in the examination. Okay, and grade 1 is asked in the examination too. Okay, so please do make a note about these two things, which are very important as a repeats. So next goes with the different types of murmurs. So first we'll deal with systolic murmurs. Okay, so it is heard between first and second heart sounds, and it is regularly soft. You will have three types in this. One is mid systolic, second one is pan systolic, third one is late systolic. And of course, the important area where you need to focus here is about the questions that are asked. Okay, so the examples for the mid systolic is AS, PS, TOF, ASD, and hypertrophic cardiomyopathy. Clear. The second one is pansystolic. The examples are MR, TR, VSD. And of course the late systolic, the answers are mitral valve prolapse. Okay, again you can see hypertrophic cardiomyopathy. Okay, so this is about the systolic murmurs. The next comes is about the diastolic murmurs. So diastolic murmurs are heard between first and second heart sounds. They are non-radiating murmurs. They are rough. Okay, and you will have two types in this, that is early diastolic and the mid diastolic. And coming to the examples, you will have AR and you will have PR, that is pulmonary regurgitation. Okay, where in this condition you can see other murmur called as Gram-Still murmur. And in the mid diastolic you can see MS and you can see the same AR. So they can ask you questions like AR is seen in AR. Both early as well as mid diastolic murmurs are seen in the case of AR, but if both options are there, it is better to go for mid as a best option. Okay, for AR. So we are done with these two, and the next one is you will have something called as continuous murmurs. So they are nothing but a combination of both diastolic and systolic, and you can see them in PDA. And few other common terms or common names that are asked in the examination. One is Carey Combs murmur, which is a mid diastolic murmur, and which is seen in the case of acute rheumatic fever. Next one is Gibson's murmur, which is also called as train in tunnel. Okay, which is seen in the case of PDA. Another one is called as Still's or Still murmur. There is something called as Still's disease. Okay, that is different. It's a question in your oral medicine. That is, it is a rheumatic fever in the case of children. That is called as Still's disease. Now it is Still's murmur. Is nothing but it is a vibratory systolic murmur, which is seen in the case of MR. The next one is something called as musical murmur. These are rarely asked questions now, which are discussing from now. Musical murmur, which is sometimes called as seagull murmur, which is seen in AR. The next one is means murmur, okay, which is seen as pan systolic murmur in thyrotoxicosis. Okay, hope you're clear. So I just want to add few important normal repeats or MCQs. I hope you know there is something called as Watten's duct that is related to your salivary glands. There is something called as Watten's jelly. This Watten's jelly structure is present in the case of umbilical cords. Okay, and they can have, this is a repeat of your NEET, that is head in downs is brachiocephalic.